For pregnant women, I think I got about 4 or 5 dental cleanings during my pregnancy.
Excellent.
I mean, my brothers are dentists, and I was visiting Dr. Simon as well during my pregnancy, but minimum of 1 to 2 cleanings, and I suggest at the end of your first trimester, which is the beginning of your second, and sometime during the end of your second and the middle of your third, just to keep everything under control, to keep the acidity in your mouth under control, and just to be following up with a dentist. It's really, really important.
And it's not going to make you go into labor.
No, yeah.
Okay, just so you know that.
Yes, thank you. Yeah. So, yes, it won't make you go to labor. Have you had to do something complex on a pregnant woman before? Like, have you needed to take out a tooth or take an x-ray on a pregnant woman? Or we suggest obviously not, but when a pregnant woman is in pain, that's a lot more distressful or distressing.
Yeah, distressing, stressful.
For the baby.
Yeah, with pregnant women, we have to be extremely cautious because there are a lot of spontaneous miscarriages, so we don't want to be part of it. So number one, no x-rays on pregnant women. So do anything that you can just not to have an x-ray, because the radiation goes through, and that's obviously risky. And yes, I did treat a pregnant woman. She had a cracked tooth, and that led to a big infection around the tooth that led to the infection going to the bone. And she was in her 2nd or 3rd trimester.
Wow.
So she was, she was up there.
Yeah.
So we had to treat her. So I had to extract the tooth. I had to give her local anesthesia, give her antibiotics, pain medications. She had a dry socket, which is some sort of a complications, but there was no other option.
Yeah.
So yes, we do treat pregnant women, but in the least invasive way. If there's no other choice, we do what we need to do.
That's why it's really important to get your mouth checked before you get pregnant. So that crack could have potentially been caught before, but things happen in life, and you got to roll with the punches. So
absolutely, and especially if you're planning to get pregnant in a scientific way with IVF, even more important, because everything is planned. So if you have the intentions and you're seeing an IVF specialist, it would be great to see the dentist and make sure that the oral cavity is healthy,
so that all the energy goes to your fertility instead of your mouth.
Yes, exactly. All the energy.
All the energy. Can you just explain how gum disease progresses?
There's a progression between 2 types of conditions. One is called gingivitis, one is called periodontitis. Gingivitis, in the most simplest way, is an inflammation of the gum tissue, of the soft tissues that surround the teeth. The gums bleed, they're swollen, they usually don't hurt, and this is a totally reversible condition. The other condition is called periodontitis, and this is when gingivitis is left untreated. Then the inflammation travels into the deeper tissues, which are the bone structure, the jaw structure, and then the bone starts to melt away. Teeth become loose, you can lose teeth, and that's called periodontitis, and different degrees of severity. That's irreversible unless you go through multiple invasive procedures with bone grafting, and sometimes the genetic component is so significant that you can't do anything anymore.
Yeah.
And patients do lose their teeth.
So better prevent periodontitis.
Prevention is worth an ounce of cure. So
absolutely.
100%.
Thank you so much for answering all of our questions, and I hope any pregnant woman, any woman, any man even. I know we're focusing on pregnancy, but gingivitis and periodontitis happens in all, but pregnant women are more prone to getting gingivitis, and if left untreated can lead to periodontitis, and you don't want to go there because it does impact also your baby. And we'll learn more in consecutive videos how that can happen. But thank you so much for your expertise, Dr. Simon.
My pleasure.
I really appreciate you here.